Good morning to the members of the media and everyone watching today. My name is Texas Senator Molly Cook. Welcome to Senate District 15, and I'm very excited to welcome Commissioner Lesley Briones as well as Congressman Al Green this morning to share some words about abortion safety in Texas as we approach early voting. And I want to welcome my dear friend and hero, Commissioner Lesley Briones.
Thank you. Good morning. My apologies. Thank you, and good morning. First of all, Senator Cook, thank you for being a champion for all of our rights, and it gives me great pride that you are my senator and our senator. So thank you for inviting me here today, and thank you in advance to Congressman Al Green, who has been fighting for decades for all of us. So I'm here today with a very heavy heart and an array of emotions, from anger to disgust to disappointment. As the first mom ever elected to Harris County Commissioner's Court in her own right, as a proud mother of 3 daughters, I am troubled. I find it deeply, deeply unacceptable that my 3 daughters have fewer rights than their grandmothers. I find it deeply unacceptable that as a nation we have turned back the clock half a century when we should all be working hard to constantly drive progress. I find it unacceptable, and I'll share that, I'm the proud mom of 3 daughters. I am a proud Latina, a proud Catholic, and I would have been sent home likely to get to near death. I had 2 horrible miscarriages between my first daughter's birth and then after my second daughter. And the medicine that the doctor prescribed didn't help. The bodies were not being ejected, and I had to be hospitalized twice. If that had happened today, they would have sent me home until I was almost at the point of death. And would I have been able to have my 3rd daughter based on the complications? Who knows? That is unacceptable that here in Texas, and I say this as a proud Texan, a native Texan, the fact that we are turning women away and sending them to be at near points of death is unacceptable. It is unacceptable that here in Harris County, where we have a world-class medical center, that Harris County leads in terms of the atrocity that we lead in terms of maternal mortality for Texas and for the country. The fact that those 2 things can be true in terms of our world-class medical care and leading in deaths is unacceptable. It's also unacceptable that our Black women, our Black sisters, are 3.5 times more likely to die. And we know that these statistics were abysmal before Jobs and before Senate Bill 8, but they have only gotten more atrocious. Harris County, we will continue fighting for you. So what Harris County Commissioner's Court can do and is doing and has done, I'll give you 5 quick examples. 1, we passed the Reproductive Access Fund to help gain access to contraception, family planning, STD screenings. 2, we invested approximately $20 million of ARPA dollars into Access Harris, with specifically a maternal and child cohort and a Black maternal mortality cohort. We have been investing in lactation pods in Harris County courthouses, but also nursing rooms in various Harris County buildings. I remember having to try to nurse and pump in very disgusting bathrooms, and no parent should have to do that. We have also invested approximately $150 million of federal ARPA funds, and I want to thank President Biden and Vice President Harris for this investment. Nearly $150 million in child care investments, so that we are poising our children for success and helping working parents get back to work. We have also passed Proposition 2, which exempts qualifying child care centers from county property taxes to make it more affordable for our working families. And 5, join us shortly. We are about to celebrate the opening of the Baylor College of Medicine Teen Clinic at Baylor is hosting this clinic for free for our community at Bayland Community Center, one of the community centers in Harris County, Precinct 4. And this will allow prevention, screenings, immunizations, reproductive access contraception for our youth ages 13 to 24. So those are 5 examples of how Harris County is still trying to advance the ball despite and in spite some of these repressive laws. I'll close with the following. I love the state of Texas. I want to live here for the rest of my days, but it is very difficult for me to raise my 3 little girls in this state, in this form. We are the solution to this. Early voting starts October 21st and will run through November 1st and November 5th. We want to wake up on November 6th knowing we did everything possible to use our voice, our vote, because our bodies are on the ballot, our democracy is on the ballot, and our freedom is on the ballot. And as a proud native Texan, when they talk about everything's bigger in Texas, I hope that one day we're not talking about highways and belt buckles. I hope that we're talking about our rights, our freedoms, our liberties, because I want to raise my little girls in a place where they can make their own decisions about their body. So Harris County will keep fighting, but again, we're in this together. Please vote. Our vote is our voice. So thank you again to Senator Cook. I'm so happy you are fighting for us in Austin. And I look forward to many years of making the Texas that all of our families deserve. Thank you.
It is an honor to get to follow Commissioner Lesley Briones in speaking today. I am joining you in scrubs because I will be on my way to work at the emergency department after this very event, where day in and day out, I see the policy failures of our state. I also want to share, and I'm honored to follow the bravery of Commissioner Lesley Briones as she shares her own personal experience with what it's like to be pregnant in Texas. And I also had that experience. And I had a procedural abortion in 2014 in Austin, Texas, when there were only 8 abortion clinics open in our state. And I'm still shocked every single morning when I wake up that I was lucky then that it was legal and it was safe. And I can tell you that on the local, the state, and the federal level, you have people here in Harris County who are working to get those rights back for you. And I'm grateful, as hard as it is, as painful it is to be one of them. In a post-Roe world, I do not have access to the care that I received in 2018 because Texas state leadership has not protected our rights. Here in Texas, for now, our leaders' priorities are misplaced. Those in statewide leadership have completely and cruelly outlawed abortion with no exceptions, not even for medical necessity, incest, or rape. Under these extreme conditions, health professionals are scared to provide life-saving care. They're threatened with life in prison or hefty fines, and I know how this feels because I'm on the ground and working with them in the emergency department. The attacks on pregnant people and pregnant women in Texas do not stop. While we're forcing births, the state of Texas refuses to create an easy pathway for pregnant women to quickly get on Medicaid. The process for getting on Medicaid, even when you're pregnant and every single second is ticking by, is a burdensome application process, and it's difficult and it's tenuous to navigate. Following the end of the COVID-19 public health emergency and the unwinding of Medicaid, Texas neglected to follow federal guidance. And because of that, nearly 2 million Texans, mostly women and children, were kicked off of health insurance in this state. Still, against the odds, my colleagues, my friends, my heroes at every level of government continue to work hard to expand health coverage for moms and babies. And just last session, authoring bills to expand women's health coverage to 12 months postpartum, up from just 60 days. It's a big step. It'll save lives. And yet there is so much work still to do. When your city and your locality in Texas try to do something for you, to protect you, to promote public health and your individual freedoms, the state punishes the localities. Because abortion is illegal in Texas, the city of Austin set aside $400,000 to help city residents pay for out-of-state abortion care, including the costs of airfare, hotel, and lodging. And we know that low-income and Black and brown communities are the most severely impacted by this abortion ban, and they may not necessarily, and often don't, have the resources required to make the long and expensive journey out of state for care. Our Attorney General sued the City of Austin, alleging that it violates the gifts clause of the Constitution of our state because these funds don't serve a public good. But I can assure you that health care is a public good and abortion access is good for public health. With Texans facing one of the harshest abortion bans in the nation, it's critical that women have the freedom to access the care and the treatment that they need. Women seeking health care shouldn't be punished by the state, but unfortunately, this is our reality under the current regime here in Texas. But every day, from now until November 5th, you have the opportunity to take action, to organize, to knock on doors, to make phone calls, and to vote for leadership that supports our right to safe pregnancies, data-driven health care, and the right to decide what happens to our bodies. I stand with our leaders at every level of government, desperately trying to provide data-driven and scientific health care to their constituencies. As an emergency room nurse, I know that we need to make decisions based on science, not scoring political points. In life or death moments, like the ones that I experience regularly in my job, medical professionals cannot be missing a beat to second guess what is the right thing to do for this patient in this moment to save their lives and to save their health because of political confusion and fear-mongering. I will also add, as I am, of course, joined today by Commissioner Lesley Briones and Congressman Al Green, who have been in this fight for much longer than I have, that I'm very grateful to be here, very grateful to be fresh, to be adding a new leader to this fight, a new person to stand up and speak out for the truth and for justice, for safety, and for health care. I'm ready to join the fight in Austin this legislative session, and our team is hard at work for you. I'm knocking on doors every single week to get out the vote in Senate District 15. Your choice of leadership begins at the ballot box, and every person in our district, every person across Harris County needs to be thinking about how their vote affects the health care that we have access to. Thank you all again so much, and we'll take just a brief break while we wait for Congressman Al Green to arrive.
We have an additional speaker from the community. This is Nabila Mansour with the Texas Multicultural Advocacy Coalition.
Good morning, everyone. My name is Nabila Mansour. I'm the president of the Texas Multicultural Advocacy Coalition. We are a group that is really trying to make sure that vulnerable communities, historically marginalized communities, have a say in public affairs. And we today are at a crossroads. Since the overturning of Roe v. Wade, the state's near total abortion ban has really forced countless women to travel across state lines in search of safe legal care. And now it's pushing abortion travel bans, a move that would not only criminalize those seeking care, but also those helping them access it. This is dangerous, and this is a dystopian step backward. Our healthcare system is already collapsing under the weight of these draconian abortion laws. A growing number of OB-GYNs are leaving Texas, and as I'm sure Senator Molly Cook knows, future doctors are avoiding our state altogether. The consequences are dire. Less access to critical maternity care, rising maternal mortality rates, and more pressure on our overworked healthcare professionals. Nearly half of Texas counties are already maternity care deserts with no birthing facilities or obstetricians. We cannot afford to worsen this crisis. What's even more troubling to us at TMAC is the impact that this has on women of color. More than 60% of those seeking abortions are people of color, and about half of them live below the federal poverty line. The majority of Black Americans in particular live in southern states like our own Texas, where we have the most restrictive abortion laws in place. These bans are perpetuating systemic inequalities. They are denying basic health care, and they are denying this to those who need it most. We are already failing to provide adequate healthcare infrastructure, and we already rank near the bottom nationally for women's health. We can't afford to make matters worse. It's time to demand an end to these catastrophic policies and ensure that no one is denied the care that they deserve. especially those who have been historically marginalized. Thank you, everyone.
Thank you so much, Nabila, and it is my honor to welcome Representative Ron Reynolds and, of course, Congressman Al Green here to SD 15 today, and I'm grateful to hear their words.
Thank you, Senator Cook, and welcome, Congressman Green. I can be extremely brief. I really agree with a lot of all of the comments that were just spoken from Nabila, who hails from Fort Bend. I am Ron Reynolds. I'm state representative for District 27 and chair of the Texas Legislative Black Caucus. And I really want to applaud Senator Cook for raising awareness of an issue that is very critical to this state. I was very disappointed on the House floor when we had the debate where Texas led with the most restrictive abortion ban in the nation. And it broke my heart to see the extreme MAGA folks taking away women's access to reproductive rights. And the worst part about it is that there was no exceptions for rape or incest. And I, as chair of the Texas Legislative Black Caucus, black women in Texas have already led the nation in maternal deaths. Texas already ranks dead last with the highest number of uninsured. And this is only exacerbating the problem, as Nabila pointed out, with women of color. We've already seen and had many instances of women of color that have been disproportionately impacted from this abortion ban. And I am, like many others, calling on my colleagues to get on the right side of history. Most Texans, when you poll, they don't find this law that we passed acceptable. And I'm looking forward to welcoming Senator Molly Cook to the legislature during the 89th legislative session. And we're going to fight. We're going to continue speaking truth to power. We're going to continue advocating. And I think it's important for me as a man to be standing here on this issue. Someone who has 2 daughters, someone who believes that women's health care is health care, and it should be accessible to everyone. And so, Senator Cook, I'm going to stand with you. I appreciate having you as someone who is a nurse, someone who is a healthcare practitioner to bring your expertise to this subject matter. And I'm going to continue to stand with people like Congressman Green and other men to stand with you and say this isn't just a women's issue. This is a human rights issue. And so thank you so much for having the vision to bring us together to discuss this. And we're going to work together to resolve this issue. And ultimately, I know Congressman Green, they'll be fighting it out on the federal level. But until that happens, we're going to have to do our part at the state level to ensure that there is access for women. So thank you again, and I'm honored to be standing with you all, and I'm going to continue to fight.
And I'd like to welcome Congressman Al Green to the microphone.
Thank you very much. And Senator, I greatly appreciate your having the wisdom, the foresight, and the vision, if you will, to bring us together on this very much needed occasion. I'm honored to always stand with my good friend and colleague, I almost said Senator, Representative Reynolds, who has demonstrated over the years that he is truly an ally of this movement. And of course, Attorney Mansour, who is with the Texas Multicultural Advocacy Coalition, does an outstanding job. She has demonstrated that she has the ability to bring people together and to make a difference. Of course, Commissioner Briones is a person that has, as a judge and as a commissioner, demonstrated her desire to make sure that justice is something that we all enjoy, and this would, of course, include women. I'm going to read a very brief statement, and thereafter I'll make a few additional comments. Let me thank the press also for being here. It's important that the masses receive this message, and this is probably the best way to get it done. We can use other forms of communicating, but communicating by way of the press still is the best way in this country to get a perfect message to the masses. Here's my statement. Women should not be denied the right to control their bodies. Denying bodily autonomy to control women is an antiquated and unacceptable idea. Since the 2021 ban on abortion care, a September 20, 2024 NBC News article reports a 56% increase in maternal mortality in Texas. In Texas, under Senate Bill 8, it is a criminal offense to assist a woman with an abortion after about 6 weeks of pregnancy, unless the woman's life is at jeopardy, and I believe we're calling that a medical emergency. We must reinstate reproductive care and address the alarming impact of abortion restrictions on women's health in Texas and nationwide, so as to prevent a woman who's having a miscarriage after 6 weeks of pregnancy from being viewed as suspicious and her body being viewed as a crime scene. The long arm of the law has no place in a woman's womb. I believe that the state of Texas has gone too far. I think that Senate Bill 8 has literally placed a bounty on a woman's behavior. A woman should not have to have her very personal and most precious moments viewed by some with some degree of suspicion. This is a very difficult decision for a woman to make. When women make this decision, they ought to do it in the privacy of their homes or special places with people that they trust, and they should have their medical advisors available to give them the best advice. It really is a decision to be made with the benefit of a doctor, a woman, and those that she trusts completely. We who draft the laws should not decide that there's a one-size-fits-all law that will benefit all women who happen to be with child. The law really has no place in this. The law should allow women to make good judgment with the best personal advisors that they have. And finally this, every man ought to be concerned about how women are treated under these circumstances, because every man owes his very existence to some woman. Some woman gave us the opportunity to have the breath of life, and I think that we sometimes overlook the fact that but for women there would be no men. My hope is that as we rethink our positions, that we will take up new legislation that will eliminate these restrictions that force women to become viewed as suspects when they have a miscarriage and force them to be seen by prosecutors as a crime scene. The long arm of the law has no place in a woman's womb.
And I will just close by thanking again, thank you to Congressman Al Green, Representative Ron Reynolds, Commissioner Lesley Briones for joining us here today, and thank you again to the members of the press for helping us call attention to this issue. Final reminder, early voting starts in 5 days. Thank you all so much.
Questions?
No, any questions? Okay, thank you.